Concerns about the coronavirus. That virus has sickened hundreds and killed 17 people overseas in China. Here are the three big developments today with the coronavirus. The city of Wuhan, China, which is at the center of the outbreak, shut down outbound flights and trains today. The World Health Organization is deciding whether to declare a global health emergency. And here in the U.S., we have one case. A man from Seattle came down with the virus after traveling to Wuhan. Concerns about the virus have people on alert, among them emergency medical personnel who need to protect themselves against infectious diseases such as the coronavirus. Channel 3 Eyewitness News reporter Kevin Hogan visited a company in Wallingford that developed a barrier system to protect first responders from becoming infected.
When emergency services such as an ambulance transport somebody who has an infectious disease, they just don't put him in the back of the ambulance. They have to prepare the vehicle first. Most ambulances look like this, but when EMTs have to transport someone who has an infectious disease such as the new coronavirus, they have to isolate the patient and equipment.
For 30 years, we've had to use plastic wrap and duct tape to tape up on the walls of the ambulance to keep the inside protected after we treat a patient.
GUERCIA is COO of BioCell. He co-designed the barrier system, now being used by first responders around the country, even getting a call last night from a fire chief in the state of Washington where the nation's first coronavirus patient's being treated after experiencing symptoms, fever, cough, and trouble breathing.
The FD there was interested in making sure that they had two of our product and could we get them some more in a short order if they needed it.
The plastic barrier costs about $400 per unit, and it takes 15 minutes to install. And when the patient's transported, it's disposed of in a biohazard container. The BioCell has added protection for ambulance crews. AMR Operations Manager Tim Craven says crews are already well protected when they come in contact with sick patients.
Simple gloves all the way up to gowning up with a Tyvek suit, mask, goggles.
Tim and Len say everyone needs to be prepared because it's a small world after all.
It's a very transient world. I can get on a plane at Bradley and be halfway around the world this time tomorrow, so everybody's on the move.
Want to learn more? Go to the Channel 3 app. With the mobile newsroom in New Haven, Kevin Hogan, Channel 3 Eyewitness News.